Yes.
I'm a student in Homeland Security,
Oh, great.
and I was wondering what the job outlook is for Gogebic County in Homeland Security.
You know, that's a good question. In general, I would say job outlook is very good. In terms of the county, you know, I can't speak specifically that. Maybe the sheriff can speak more specifically that. What do you think, Sheriff? What do you think? How's the job prospects for somebody in Homeland Security?
Not very good right here locally.
Right.
There are Homeland Security employees, people out of Duluth, out of Sault Ste. Marie, and there are some new grads that became available for some bordering areas. I know Ashland, Wisconsin was lucky to get some sort of grants from Homeland Security. Other than that, in our county, Homeland Security is basically through the airport, the Transportation Security Administration, the Department of Homeland Security. County, in our in-house county would be the only actual employee at the airport, which is important.
Yeah, no, it is important. That's, yeah, it's another important reason for the airport. So you guys need to talk. You guys need to talk. But yeah, I do know. I do know. I was going to mention this too because you know once we get over on the other side of the UP, there's much more being done there, both because of the bridge and locks and everything. There's much more being done there, and then a lot of more opportunities downstate related to the border crossings.
I'll take one note.
Yeah.
As far as traveling, Homeland Security, the Department of Homeland Security is a number of jobs, but not locally.
Yeah.
If you're willing to relocate to different areas, maybe metropolitan areas and border areas, there is a lot of jobs in Homeland Security, but locally, in Luke County.
Yeah. Yeah, that was my reaction as well. Good.
Thank you.
Yes. Yeah.
Could you speak a little bit about the community health centers? It said there were 184 of them in the state, and there's going to be funds to building new. Is that referring to existing medical practice clinics, or is this, what is this exactly?
Okay, it's both. It's when we passed the health insurance reform bill, the new pool that will become available for people to buy through that don't have insurance and for small businesses to buy through, that it's really like a network. All the private insurance companies will come together and each vie for your business by trying to give you a better bid. It's like a network, but that's not being set up till 2014. They're trying to phase in the cost. So between that, the reason, because it's not till 2014, in the short run, we put a major investment for community health centers and to help, create more ways for people to get health care until this new system is set up. And it's actually the largest investment our country has ever made, $11 billion to be invested. And it's starting now. They're starting this fall to take applications. They expect to set up about 10,000 centers across the country, and I want to get as many of those as we can in Michigan. And it's an application process through to be set up as a federally qualified health center or just a community health center. And there's both, as you know. If you want to get Medicaid or Medicare reimbursement, you have to become a federally qualified health center. But it is for both new centers and also expanding, or what's called lookalikes, or or new satellites. Doesn't have to necessarily be a whole new operation. It could be so. But now's the time, and Steve can get you information about that in terms of applying and so on. There is a website that's very comprehensive. It's just called healthcare.gov, G-O-V, and in there's also a section on community health centers. But if that's something you're interested in, it is the whole idea of having a community health center with doctors and nurses is to really get people away from an emergency room that doesn't need to be in an emergency room. They just need to see a doctor. We pay so much money. Everybody who has insurance sees their rates go up every time somebody walks into the emergency room and gets care that could have gotten it by seeing a doctor or seeing a nurse. Because what happens is everybody's cared for. When you go in the emergency room, they care for everybody, and then they just raise the rates of people's insurance to pay for it. So one of the reasons why having everybody in a healthcare system saves money is that people then get care on the front end by going to a doctor and can get cancer screenings and preventative care, and so on the front end, instead of waiting till they get sick and ending up in the emergency room. So, but community health centers are a way to, it's a very low cost way to help people in a center, in a clinic, be able to see a doctor rather than going to the emergency room.
Senator, I think we have time for one more quick
Okay,
question, and then we gotta get to Iron Mountain.
All right.
All
Right.
right. There's a young person over there.
Yes,
Hi,
we'll take two.
I'm going to school for law enforcement, and I'm supposed to go to the academy next year for an officer.
Great.
Does the Pell Grant cover the help pay for that? Or
It would pay for the academy part or for the school part?
the academy?
You know what, I don't know. Is the academy through the community college?
It would be through Marquette College.
I think so. If it's through the community college setting, I think so. Check with your financial aid office, but I think so. So, I actually studied law enforcement in my undergrad, and I got spirited up in a different direction. I loved it. Yes?
Mine isn't so much a question, but I guess in support of the rural development program, I appreciate everything you've done.
Yeah.
Waco right now is ready to close on a $9 million project, $2 million for, I think, in grant, and $7 million in loan, which is we're actually going to refinance some of our existing debt because of the interest rate basically being cut in half.
Yeah.
And through this project, we hope to get rid of an administrative consent order that's been issued by the state. So I appreciate everything that you've done as far as the rural development program. The other thing is, as you travel through town, I don't know if you noticed, we had the community building that was an obsolete, dangerous building. We had a special appropriation that was, we worked with your office, Senator Levins and Congressman Stupek.
Yeah.
The building has been taken down through the special appropriation HUD funds.
Right.
And we now have subsequent requests for a new building.
Great.
So,
Happy to
and
support.
again, I appreciate your help for everything you've done with the programs that help the cities.
Yeah, no, happy to do it. Yeah. Great. Well, thank you so much. It's wonderful to be here.